This morning, we continue our conversation with Dr. Travis Gratton of University Veterinary Care Center on cognitive decline in aging pets. This morning, we're going to be talking about some management and therapy ideas for that.
Yeah.
Dr. Gratton, thank you for being with us today. So let's just start with the basics, though. What is an aging pet? What defines an aging pet?
So generally for dogs, it can start as young as 6, but certainly as you get into the 8 to 10 year category, and then absolutely when you get up into the 12 to 15, then we're definitely in the older categories. Cats tend to age a little bit better for a little while longer, but certainly once they're up 10, 12, and 15, then you're basically dealing with the senior citizens class of pets.
All right. Well, where do we start if we know that our pet has some cognitive decline, they're experiencing that? Where do we start with management?
Yeah, well, the cognitive decline happens in varying degrees. There's some different data out there as to how often it is, but most of us have certainly seen it, at least in some of our pets. You know, as their brains kind of age and deteriorate, you get into the confusion and the wandering, and you know, their mental acuity just isn't quite what it was, and so we need to make some accommodations for them. You know, some of them really kind of have to be into assisted living kind of facilities where we make it easier for them to get around, make it a little less difficult for them to you know, wander off and pace and get lost, and comfort levels need to be taken advantage of. You know, resting places can be made more accessible. Cat perches can be, you know, access to window perches and things like that, just so that they can continue their normal lifestyle. And we want to kind of go slowly with any changes that occur in the households. Older pets just don't cope with sudden changes near as well as the young ones do.
Well, when we're thinking about cognitive decline, how important is physical activity?
Really, one of the most important things we can do is keep them active. You know, and certainly as they get older and you get into other comorbidities, arthritis and that type of thing, we need to manage those so that we can keep them active and engaged. But you know, mental function is very much like in people. It's a use it or lose it type of scenario. If they just sit around and sleep all day and don't get up other than to go to the bathroom a few times and eat dinner, and don't have the social interaction with either other pets or people in the household, you know, the mental decline really does accelerate pretty dramatically sometimes.
What are some ways we can keep them mentally engaged?
Certainly, you know, continue to play with them, manage the arthritis, keep them active, keep them going for walks. You know, outside is mental stimulation, both you know, sensory and auditory. Sometimes hearing is a little faded, but most dogs maintain their sense of smell, and so getting them out and about and doing things. But we can play games with them. You can do even simple obedience. A lot of us do it as puppies, and then we kind of do it once in a while when they're adults, and we just never really do it. But if we keep them thinking about things, using their minds and their bodies, we are sensory-driven central nervous systems. If it is all about the sensory input going into the brain, the spinal cord, that keeps the brain and spinal cord functioning the way it should. And when you start losing that in isolation, and pets often kind of, especially as they get older, tend to self-isolate, you know, things kind of go downhill.
Sure. Well, we are almost out of time, Dr. Gratton, but how does medication, supplements, diet play a role? Yeah,
there are couple of medications that have shown some benefit on the market, so definitely talk to your veterinarians about that. There's a couple of diets that have some at least decent research behind them to say that they can slow the progressions, certain levels of antioxidants and other things that help slow the progression. You know, we can't stop it, just like some of the age-related dementia in people, but you can manage it along the way, and someday we'll get better at doing that. And supplements can certainly be helpful as well, as long as they're used in conjunction with, you know, other things, and we're having that conversation about what to mix and what not to mix together.
Okay, important conversations to have with your vet. Dr. Gratton, thank you so much for being with us today. And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.